It's time now for Medical Rounds. The pandemic has certainly been a difficult and stressful time for so many. Joining us to talk about the impact COVID-19 has had on mental health is Jessica Collins, the Director of Behavioral Health at the Hospital of Central Connecticut and Midstate Medical Center. Welcome, Jessica.
Thank you. Thank you for having me.
We hear about mental health, but really, what kind of impact are you noticing that COVID has really had on mental health?
The pandemic has really forced people into a constant state of fight, flight, or freeze, and really having increased feelings of anxiety and depression. This inability to escape COVID and the effects that it has in any aspect of our life, work, school, social, has only further exacerbated this effect.
And then how does our mental health affect our physical health?
These feelings that I was talking about with anxiety and stress that the pandemic has created can lead to changes in eating and sleeping habits for many people, and an exacerbation of current medical conditions such as hypertension, diabetes, and other chronic medical conditions. People who are trying to cope during this time may choose unhealthy coping skills such as substance use or changes in their eating and drinking, and this can exacerbate those medical conditions.
So what are some of the signs that someone really needs professional attention?
Any individual who's noting that they're having changes in their sleep, their eating, changes in their coping skills, and overall feelings of anxiety and stress that start to impact their ability to function in their day-to-day life successfully, they may want to seek some professional attention. If you or a loved one are experiencing any suicidal thoughts or feelings, or noticing an increased use of drugs or alcohol, seeking professional help is strongly encouraged during this time.
And what about things to do just to cope during these difficult times?
Yeah, it's really hard. So trying to find a familiar routine that you're comfortable with, especially like I mentioned before around sleep and eating, finding a healthy coping skill that works for you and practicing it, meditation, yoga, exercise, going to church. Take breaks from electronics and media, allow your mind to heal from all of that overstimulation, and ask for help. The main thing I could say is to give yourself permission to not have it all together during this time and to be patient with yourself and others. It's really a challenge.
Yeah, we got to remind ourselves if we're doing okay, that's actually great right now. And you just real quick, we only have 10 seconds left. You have a virtual class coming up January 19th from 12 to 1. You'll really be talking about some of these resources and promoting healing during this time.
Absolutely. Look forward to having people join.
Thank you so much for being with us, Jessica.
Thank you. Have a good day.
You too. And to register for the class, you can visit hartfordhealthcare.org/virtual classes. We can all use a little help right now.